The symptoms that I had with PMS were severe bloating,
very strong breast tenderness,
a lot of depression,
terrible headaches,
a lot of water retention.
I was very tired a lot.
I was barely able to get through a day.
mood swings.
Crying and feeling very anxious.
As a result of the treatment with the acupuncture, the herbs, the homeopathy, my home life has definitely improved.
I truly didn't believe in acupuncture and herbs and so forth for that problem, and once I did it, I was quite amazed.
First of all, the swelling went down.
I got relief almost immediately.
Now I feel that I'm more balanced.
I also realized that I slept better after that, too.
Crying.
The acupuncture and the herbs really, truly helped me.
My husband has noticed a complete change. I mean, our whole relationship has changed. I'm happier, he's happier because I'm happier.
It makes you feel so much better. You just feel renewed, rejuvenated.
Sometimes I hardly ever notice him even having a period.
I think every woman should do it.
I would recommend this approach to anybody who has any problems with PMS.
It really helps. It really has worked for me.
It just gets better and better.
For millions of women, PMS is a fact of life. Though symptoms vary dramatically, even from month to month among individuals, the results can have a devastating effect on a woman's physical and emotional health.
This video is intended to provide general information only. If you are currently being treated by a doctor, do not substitute any of these treatments for your current medication without first consulting him or her.
The purpose of this tape is to help you identify the PMS symptoms that you are suffering from and to provide you with the holistic treatments that will help to relieve your suffering.
PMS is one of the most common health problems facing women today. Symptoms usually begin 10 to 14 days prior to the start of menstruation and end within the first few days after its onset.
There are more than 150 symptoms associated with PMS, and symptoms may change from month to month, some months even disappearing completely. PMS is caused by psychological and physiological imbalances. Psychologically, the primary cause is stress. Physiologically, the primary cause is an imbalance of estrogen or progesterone. Secondary causes include poor diet, heredity, and lack of exercise. Traditional medicine tends to treat PMS with over-the-counter drugs, synthetic hormones, or surgery.
But for most women, PMS symptoms can be treated naturally using acupressure, acupuncture, herbs, and dietetic changes that you can do at home. Because the cause and symptoms of PMS vary, treatment will also vary. PMS can be grouped into 6 classifications based on the kinds of symptoms most commonly experienced. Remember, you may experience symptoms from more than one classification, often simultaneously.
Type 1 PMS is typified by anxiety, irritability, and mood swings. 80% of women with PMS have type 1 symptoms. Type 1 PMS is caused by an abundance of estrogen relative to progesterone levels. Type 2 PMS is experienced by 60% of women and is typified by an increase in cravings for carbohydrates, including sweets, alcohol, chocolate, bread, and pastries. Eating these foods creates even more cravings, which in turn causes mood swings, fatigue, headaches, and dizziness. The cause of type 2 PMS is hypoglycemia or low blood sugar. Type 3 PMS or hyperhydration is experienced by 40% of women with PMS. Symptoms include bloating, swollen and tender breasts, weight gain, migraine headaches, and vision problems. Type 4 PMS is seen in only a small percentage of women, but it has the potential to be the most serious form of PMS. Symptoms include depression, confusion, insomnia, memory loss, and even suicidal thoughts in severe cases. It is caused by the ovaries not producing enough estrogen. Type 4 PMS will not respond to the traditional progesterone treatment many Western-trained medical doctors use. The 5th grouping of PMS symptoms includes blackheads, cystic acne, oily skin, or other skin problems. These problems are usually caused by lower levels of estrogen or by an increase in male hormones which affect skin pH. The sixth type of PMS symptoms include cramping, diarrhea, shooting pains, nausea, vomiting, and low back and/or leg pains. These symptoms can last anywhere from 1 to 4 days and are due to an excess of a chemical called prostaglandin F, which is produced in the uterus. To treat your PMS, a calendar similar to this one should be kept. This will help you in analyzing your symptoms as well as provide important information to a professional if symptoms require a consultation.
Diet is the first and foremost factor within your immediate control. Foods known to increase symptoms of PMS include caffeine, milk, hard cheese, salt, fats, fried foods, chocolate, sugar, alcohol, beef, shellfish, pork, and pickled foods. By avoiding these foods, you can often dramatically reduce and even eliminate PMS on your own. Foods helpful in reducing symptoms of PMS include whole grains such as brown rice, oatmeal, and millet, whole grain breads with no added oils, salt, or sugar, all vegetables, but especially beets, carrots, collard greens, mustard greens, and beet tops, fish, and all kinds of beans, which are your best source of protein as well.
Certain vitamin and mineral supplements can also be helpful. The two most important are vitamin B6 for bloating and water retention, and magnesium for cramps and uterine pain. Vitamin C is important to combat stress, as are all the B vitamins. Menstrual cramps are relieved by doubling up, bending forward, and applying a warm compress. If you suffer from cramps, be sure to take twice as much magnesium as you do calcium. Evening primrose oil or blackcurrant seed oil will help reduce uterine cramping. Two of the most common homeopathic remedies are Mag-Phos and Colocin. If you have never taken homeopathic remedies and are not familiar with the specific guidelines, be sure to ask a homeopathic professional prior to taking homeopathic remedies, or read Dr. Martin's book, Optimal Health. 20 to 30 minutes of daily exercise also plays a large role in balancing hormone levels. Outdoor exercise has been shown to be more beneficial than indoor exercise. Chromium is a great supplement for treatment of type 2 PMS. It has a regulating effect on blood sugar. Try this along with licorice root tea to strengthen the adrenal glands. Dandelion root tea will help to detoxify the liver, and red raspberry leaf tea is good for toning the thyroid gland. Vitex and Dong Quai help balance the hormones. For skin problems, use cayenne to detoxify, ginger root tea to help in digestion, and burdock root for its blood cleansing effects. For hypoglycemia, low energy, or mood swings, add licorice root and burdock root to dandelion root. Digestion troubles can lead to skin problems and/or bloating, so be sure to take digestive enzymes or a good digestive tea such as poney, ginger, gentian, or peppermint. For symptoms of fatigue or weakness, try the homeopathic Kali-Phos. Homeopathic sepia is also good for fatigue. For sepia to be indicated, you will usually also have low back pains, cramping in the lower abdomen, loss of interest in sex, and an increase in anger and intolerance for others. Depression and moodiness are also common. Sepia is a common remedy for use in type 4 PMS. For excessive weeping, sadness, or hypersensitivity, a primary remedy is pulsatilla. Other indications for pulsatilla are a desire for company, a desire to be outside, to have windows open, nausea, fainting, or changeable moods. Homeopathic chamomile is another remedy for excessive moodiness, irritability, and cramps that feel like labor pains.
In many cases of PMS, acupressure can also be an effective treatment. These pressure points can help relieve the discomfort associated with PMS.
Keep in mind that if you know what you are doing, it's fine to treat yourself with homeopathic remedies. Although a long-term PMS problem requires a doctor's assistance. Professional treatment may include a variety of holistic methods, including acupuncture, which is extremely effective. In most cases, with the suggestions on this tape, you can expect a significant reduction in symptoms within 2 to 4 menstrual cycles. Thanks for watching.
Dr. Martin is a respected authority on women's health, using the techniques of Oriental medicine, homeopathy, acupuncture, nutritional counseling, and herbal medicine.
All of the products mentioned in this video are available in health food stores and pharmacies. You may also order them from the offices of Dr. Martin. Other helpful products available include Dr. Martin's newsletter for optimal health, his book, Optimal Health, and a variety of other self-help tools and audio cassettes. Please write or call for a free brochure and newsletter.
For more information, or to schedule a phone or personal consultation with Dr. Martin, please call 310-576-4908.